Hello guys, welcome back to the Unacademy live YouTube channel. So guys, today in this short discussion video, okay, we are going to discuss few important topics from the section of upper limb anatomy, right? Few important topics from the section of upper limb anatomy. So we are going to discuss about the uh, various muscles and their nerve supply. We are going to discuss the branches of the various arteries, right? And we are also going to, okay, and we are going to discuss some important MCQs that will be helpful for you in the upcoming NEET PG 2022 exam, right? So guys, let us begin. So just say hi to me if my voice and my video is clear to you guys. If my voice and video is clear to you guys, let us just give me a thumbs up. It will be a fast discussion, a fast revision for you guys that will be helpful for you, right? And in the coming last days, I'm going to discuss few important topics from the anatomy on the Unacademy live YouTube channel, right? So how are you guys doing? Hi Osama Sheikh. Just give me a quick nod and we can begin the session. Just give me a quick nod and we can begin the session. Come on guys, let us not waste much time. Okay, so so guys, Horner syndrome. Okay, this is the first question for you. Horner syndrome may occur in the lesion of. I want you guys to reply in the chat section all the answers. Try to reply in the chat section. Horner syndrome may occur in the lesion of gray ramus of T1, gray ramus of T1, white ramus of T1, gray ramus of C8, and white ramus of C8. Anyone guys, what is your answer for this? So guys, we all know what are the features. Okay, what are the features that we are going to see in Horner syndrome? These include meiosis, anhidrosis, meiosis, anhidrosis, enophthalmos, and we are going to see loss of ciliospinal reflex. Loss of ciliospinal reflex, right? Now the question is, okay, so Horner syndrome may occur. It occurs in the lesion of. White ramus of T1. White ramus of T1. Okay. Then moving on to the next question. Which of the following structures of the brachial plexus? Simple question. Simple question from the brachial plexus that can be asked in your exam. Which of the following structures of the brachial plexus do not give any branches? Which of the following structures of the brachial plexus do not give any branches? Which of the following structures of the brachial plexus do not give any branches? Come on guys, what is your answer for this? Which of the following structures of the brachial plexus do not give any branches? Roots, cords, trunks, divisions. Okay, roots, trunks, cords, divisions. इसमें से कौन सा स्ट्रक्चर है that is not going to give any branches? So I'm waiting for your answers, only then I will proceed, right? Which of the following structures of the brachial plexus will not give any branches? Will not give any branches. Anyone guys? Anyone? So guys, the structure that is not going to give any branches, it is your divisions. Okay, so let us now discuss few important things from the section of brachial plexus. So guys, we all know this brachial plexus is formed by, okay, C5, C6, C7, C8 and T1 nerve roots, right? C5, C6, C7, C8 and T1 nerve roots, right? So C5 and C6 are going to join. C5 and C6 are going to join to form the C5 and C6 are going to join to form the upper trunk. Okay, C5 and C6 are going to join to form the upper trunk, right? C7 is going to form your middle trunk. C7 is going to form your middle trunk, right? And C7 and C8 they are going to join to form the lower trunk. They are going to join to form the lower trunk, right? Now guys, what is going to happen? This upper trunk is going to give, each trunk is going to give two divisions. Okay, each trunk is going to give two divisions. So divisions will be given by all the three trunks, right? So these include anterior and the posterior divisions, anterior and the posterior divisions, right? So we should know how is your, okay, now these divisions, they will join to form the chords. These divisions will join to form the chords, right? So we should know, guys, we should know how are these chords formed by, so lateral chord, guys, it is formed by, joining of which two structures, which two divisions? Come on, guys. Lateral cord is formed by joining of which two divisions? Lateral cord is formed by joining of which two divisions? Anyone in the comment section? Anyone in the comment section? Lateral cord is formed by joining of which two structures? Lateral cord is formed by joining of which two structures? So guys, lateral cord is formed by joining of upper and middle trunk. Okay, lateral cord is formed by joining of upper anterior divisions of the upper and the middle trunk, right? And the anterior division of the lower trunk, is going to form the, very good Samir, okay, anterior division of the lower trunk. Listen to me very carefully. Anterior division of the lower trunk is going to form what? Anterior division of the lower trunk is going to form what? Come on, guys. I'm waiting for you in the chat section. Anterior division of the lower trunk, it is going to form the medial cord. Okay, anterior division of the lower trunk is going to form the medial cord, right? Then guys, posterior divisions of all the three trunks, is going to form what? Posterior divisions of all the three trunks, is going to form what? Posterior divisions of all the three trunks is going to form the posterior cord, right? So guys, what is the question that I asked you? I asked you guys, which part of the brachial plexus is not going to give any branches? Okay, so I told you that the answer is divisions. So now let us have a look. What are the branches which are coming from the root of the brachial plexus? Branches which are coming from the roots of the brachial plexus. Okay, what are the branches which are coming from the root of the brachial plexus? So guys, which is this branch that is coming from the root of the brachial plexus? Come on, guys. This is your long thoracic nerve. Very good, NEET plexus. Okay, this is the long thoracic nerve. Okay, and this long thoracic nerve is going to supply which muscle? Long thoracic nerve is going to supply which muscle? It is going to supply your serratus anterior muscle. Right? And another branch that is going to come up, that is going to come from the roots, very good, NEET plexus. What is your actual name, NEET plexus? The branch that is going to come from the C5 nerve root will be your dorsal scapular nerve. dorsal scapular nerve. Okay, and guys, this dorsal scapular nerve is going to supply which group of muscles? Dorsal scapular nerve is going to supply your rhomboids, right? Rhomboids and levator scapulae, right? Hi, Dr. Perak. Okay, you are first year. Great, great. Okay, then guys, which are the two branches? Which are the two branches which are going to come from the upper trunk of the brachial plexus? Which are the two branches which are going to come from the upper trunk of the brachial plexus? The two branches that are going to come from the upper trunk of the brachial plexus. So these include your suprascapular nerve, suprascapular nerve, and your nerve to subclavius. Okay, so these are the two branches that are going to come from the upper cord. Okay, now guys let us discuss the branches which are going to come from the lateral cord. Okay, so lateral cord is going to give three branches. So which are these three branches? So these include your lateral pectoral nerve. Then you have lateral root of median nerve, and the branch, and one more branch. Can anyone tell me in the comment section what is the third branch from the lateral cord of the brachial plexus? What is the third branch? Okay, what is the third branch from the lateral cord of the brachial plexus? The third branch is no, it is not medial pectoral nerve. The third branch from the brachial plexus, it is your musculocutaneous nerve, right? Then guys, branches from the medial cord of the brachial plexus. The mnemonic is 4MU. 4MU. Okay, where M stands for medial cutaneous nerve of arm, medial cutaneous nerve of forearm. Then you have medial pectoral nerve, and you have one more branch, that is the medial root of median nerve. And the fifth branch, what is the fifth branch? That is going to come from the medial cord? Fifth branch, anyone guys, anyone in the comment section? Fifth branch from the medial cord of the brachial plexus is fifth branch from the medial cord of the brachial plexus is very good, Samir. It is ulnar nerve, right? Then guys, talking about the branches which are going to come from the posterior cord of the brachial plexus. So the mnemonic is very simple, it is ulnar. The mnemonic is ulnar. Okay, where U stands for upper subscapular nerve. Okay, then L stands for lower subscapular nerve, right? And N stands for nerve to latissimus dorsi, also known as thoracodorsal nerve. A for A stands for axillary nerve. And R for a radial nerve. Okay, so guys, we are now clear with the branches of the brachial plexus. Now guys, moving on to another important question. In the image, which of the following is not a possibility? Okay, which of the following is not a possibility? Let us have a look at this image. Okay, so guys, which injury is taking place? Okay, there is hyperextension of the neck. There is extension of this neck, and this extension of this neck, guys, it is resulting in injury to the upper cord. This extension of the neck, it is resulting in injury to the upper upper trunk of the brachial plexus. Okay, so this upper trunk of the brachial plexus is injured. Okay, and the nerves which are injured, okay, the nerves which are involved is your axillary nerve is involved. Okay, then suprascapular nerve is involved, right? Because these nerves are involved, okay, then your musculocutaneous nerve is involved. Can anyone tell me what is the action of musculocutaneous nerve? Okay, so musculocutaneous nerve is going to supply the flexors of the arm. Musculocutaneous nerve is going to supply the flexors of the arm. So in the image we have been shown to us Erb's paralysis. Erb's paralysis is being shown to us, in which there is injury to the upper trunk of the brachial plexus. Okay, so the muscles involved will be your brachialis muscle, because of which extension. Okay, the elbow will lie in the extension position. Flexion of the elbow will not be possible. Right? No, this is true. Sensory loss will be there on the outer aspect of the arm. Okay, because it is supplied by your axillary nerve. Sensory part of the upper outer aspect of the arm is supplied by your axillary nerve. That is why there will be a sensory loss. Okay, there will be brachioradialis is also affected. Brachioradialis muscle is also affected in Erb's paralysis. Because of this, there will be pronation at the radio-ulnar joint. Right? Talking about the abduction and medial rotation, okay, this will not be possible. Because your deltoid muscle is affected. Deltoid and supraspinatus muscle, which are going to help in the abduction of the arm and medial rotation of the arm, these muscles are going to be affected. That is why this will not be possible. Right? Now, guys, moving on to the very simple question: which of the following nerve is not directly related to humerus? Which of the following nerve is not directly related to humerus? Anyone? Which of the following nerve is not directly related to humerus? Axillary nerve, median nerve, ulnar nerve, radial nerve. Which of the following nerve is not directly related to the humerus? No, the answer is not C. Anyone else who would like to answer this question? Which of the following nerve is not directly related to the humerus? No, axillary nerve is also related to the humerus. Anyone else? Jagan Kathir? No, it is not axillary nerve. So now you have just two options remaining. What is your answer? Guys? Which of the following nerve is not directly related to the humerus? Anyone else who would like to make any guesses? Which of the following nerve is not directly related to the humerus? Okay. So the answer is median nerve. Okay, median nerve is not directly related to the humerus. Okay, so guys, axillary nerve, it is related to the neck of the humerus. Okay, so we all know. Yes, very good, Dr. Anushri. Okay, we all know that axillary nerve and posterior circumflex humeral vessels, okay, they are going to pass through the quadrangular space and enter into the posterior aspect of the arm, enter into the posterior aspect of the arm. Radial nerve, guys, we all know it is related to the shaft of the humerus. That is why in fracture of the shaft of the humerus you have radial nerve injury. Okay, fracture of the shaft of the humerus, you have your radial nerve injury, right? And what are we going to get? What are we going to get in radial nerve injury? We are going to get wrist drop, right? And your ulnar nerve, it is related to the medial epicondyle, right? Medial epicondyle, right? So median nerve is not directly related to the shaft of the humerus. Median nerve is not directly related to the shaft of the humerus, right? Then, guys, moving on to the next question. Ape thumb deformity is seen in lesion of median nerve in the arm, lesion of median nerve in the carpal tunnel, both A and B. None of the above is true. Okay, so ape thumb deformity you are going to see in which case? Very good, Sakti. Venkatesan. So, ape thumb deformity will be seen in injury of the median nerve in the forearm as well as injury of the median nerve in the carpal tunnel. Okay. So, guys, why do we see this ape thumb deformity? Why do we see this ape thumb deformity in median nerve injury? Okay, which muscle is responsible for ape thumb deformity? Which muscle is responsible for the ape thumb deformity in the median nerve injury? Not opponens pollicis muculburia. Not opponens pollicis. Anyone. Which muscle is responsible? Okay, which muscle is responsible? Okay, for ape thumb deformity in median nerve injury? Okay, which muscle is responsible? Okay, that is causing the ape thumb. In median nerve injury. Which muscle is causing this? Anyone, guys? Anyone? Which muscle is causing this ape thumb deformity? Anyone? Very simple question, guys. Very simple question. Okay, so guys, let us have a look at all the muscles which are supplied by your median nerve in the hand. Can anyone tell me? Okay, median nerve is going to supply which all muscles in the hand? Median nerve is going to supply which all muscles in the hand? So in the hand, all the muscles, okay, all the muscles of the hand are supplied by which nerve? All the muscles of the hand are supplied by which nerve? Anyone? Not abductor pollicis brevis. Okay, all the muscles of the hand are supplied by which nerve, guys? All the muscles of the hand are supplied by which nerve? Come on, guys, you have to be fast. This is a revision session. Okay, all the muscles of the hand, these are supplied by ulnar nerve. Okay, ulnar nerve. And the muscles of the hand you are going to use to play guitar. You are going to use it to play piano. That is why it is known as musician's nerve. Okay, but there are few exceptions to this rule. Okay, okay, the exception is your first two lumbricals. Okay, first two lumbricals. These are supplied by median nerve, right? And then the muscles of the thenar eminence, which include your flexor pollicis brevis, opponens pollicis, and abductor pollicis brevis. Okay, all these muscles are supplied by your median nerve. Okay, so guys, one muscle, okay, one muscle of the thenar eminence which is not supplied by, the median nerve, one muscle of the thenar eminence which is not supplied by the thenar eminence, which is not supplied by the median nerve, it is your adductor pollicis. Okay, adductor pollicis, okay, it is not supplied by the median nerve, right? That is why, guys, that is why, okay, that is why in injury of the median nerve, you will see that there will be an unopposed action of the adductor pollicis. There will be an unopposed action of this adductor pollicis, and this is going to result in the ape thumb deformity. Okay, so guys, adductor pollicis muscle, everyone in the comment section, this will be asked in your NEET PG exam. This is a very favorite question of the examiners. Okay, adductor pollicis muscle is supplied by which nerve? Anyone? Adductor pollicis muscle is supplied by which nerve? Come on, guys, it is supplied by the ulnar nerve. ठीक है, ulnar nerve is going to supply the adductor pollicis muscle, right? Is that clear with you? Very good Maverick, Arjun, Mukul, Sukhbir, Arjun, Aryan. ठीक है, so guys, अब हम चलते हैं अगले. All of the following muscles are paralyzed in injury to the median nerve at the wrist, except okay, all of the following muscles are paralyzed in injury to the median nerve at the wrist except. Now everyone, A, B, C or D? What is your answer for this question? What is your answer for this question? What was the reason for ape thumb deformity? ठीक है, so median nerve injury होगी. Median nerve is responsible for the abduction of the thumb, because abductor pollicis is supplied by your median nerve. But when there is injury of the median nerve, okay, abduction will not take place because median nerve is injured, and there will be unopposed action of the ulnar nerve. Which is supplying the adductor pollicis muscle. That is why. Okay, is the voice not clear? Is the audio fine or not? Because of the unopposed action of the ulnar nerve. Right? So all of the following muscles are paralyzed in injury to the median nerve at the wrist except your adductor pollicis muscle. Okay, right. So guys, tell me all the muscles of the forearm are supplied by which nerve? Come on, guys, very simple question. All the muscles of the forearm are supplied by which nerve? कौन सी नर्व है जो कि फोर आर्म के मसल्स को, फ्लेक्सर कंपार्टमेंट ऑफ द फोर आर्म, लेट मी ऐड वन वर्ड, फ्लेक्सर कंपार्टमेंट ऑफ द फोर आर्म. All the muscles of the forearm, flexor compartment of the forearm, are supplied by which nerve? बहुत ही simple. Guys, I'm going to tell you, if you are able to do all the easy questions right from every subject in the NEET PG exam, no one is going to stop you from doing well. No one is going to stop you from getting a branch of your choice, right? So that is why, guys, all the muscles of the flexor compartment of the forearm, these are supplied by median nerve. Median nerve is going to supply all the muscles of the flexor compartment of the forearm. So what will the examiner do? The examiner will ask you the exception here. What is the exception here? What is the exception here? Yes, very good Sukhbir Singh. Very good Sukhbir Singh. All the muscles of the forearm, all the muscles of the flexor compartment of the forearm, these are supplied by median nerve. The exception is, flexor. The exception is flexor carpi ulnaris muscle. Very good. One is flexor. Just hold on. Hold on. Just hold on. All the muscles of the flexor compartment of the forearm are supplied by ulnar nerve. The only exception that you have, it is your flexor carpi ulnaris muscle and no, and other muscle that is supplied. The other muscle that is supplied by the ulnar nerve in the forearm, it is your medial half of the flexor digitorum profundus. Flexor digitorum profundus muscle. Flexor digitorum profundus muscle. Right? ठीक है. Lower lateral part of the arm. Lower lateral part of the arm is innervated by. Lower lateral part of the arm is innervated by. Okay, another interesting question. Lower lateral part of the arm is innervated by. Anyone who would like to answer this question? Lower lateral part of the arm is innervated by. So guys, let us have a look at the cutaneous nerve supply of the arm. Okay, so guys, tell me upper outer aspect of the arm. Is supplied by. It is supplied by branch of the axillary nerve. It is going to supply the upper outer aspect of the arm. Then medial aspect of the arm. Okay, medial aspect of the arm is supplied by. Anyone. Medial aspect of the arm is supplied by. Medial aspect of the arm is supplied by. No. Medial aspect of the arm, it is supplied by a branch of the medial cord. That is the medial cutaneous nerve of the arm. Medial cutaneous nerve of the arm. Okay, it is going to supply the medial aspect of the arm. Okay, then the posterior aspect of the arm. Posterior aspect of the arm is supplied by. Posterior aspect of the arm is supplied by. Medial cutaneous posterior aspect of the arm is supplied by. Posterior internerve. Posterior aspect of the arm is supplied by posterior cutaneous nerve of the arm. And guys, posterior cutaneous, posterior cutaneous nerve of the arm, it is a branch of the radial nerve. Before it enters the spiral groove. Okay, then guys, the question that we were discussing here, lower lateral part of the arm lower lateral part of the arm, it is innervated by your branch of the radial nerve. Branch of the radial nerve in the spiral groove. Branch of the radial nerve in the spiral groove, right? So guys, this was the cutaneous supply of the arm. And your axilla, Sukhbir Singh, axilla will be supplied by the intercostal nerve, intercostobrachial nerve, right? Right, Sukhbir Singh, in the branch in the spiral groove, branch in the spiral groove, right? Right. If C6 and C7 nerve root is injured, sensations of which part of the limb, upper limb, will be lost? If C5 and C6 nerve root is injured, sensations of which part of the upper limb will be lost? So guys, let me draw an upper limb for you. Let me draw an upper limb for you. Okay, this is the upper limb. This is the upper limb. Okay, this is the upper limb, right? So guys, if we have a look at this upper limb, okay, so the lateral aspect, okay, it is supplied by the C5 dermatome. Very good, Hemal, very good, Hemal. Okay, then the thumb and the lateral aspect of the forearm, this will be supplied by the C6 dermatome. Then your index, middle and ring finger. Okay, index, middle and ring finger, these will be supplied by the C7 dermatome. Index, middle and ring finger will be supplied by the C7 dermatome. And talking about the little finger, it will be supplied by the C8 dermatome, right? Then guys, which of the following is not a branch of the first part of the subclavian artery? Which of the following is not a branch of the first part of the subclavian artery? Simple question. Which of the following is not a branch of the first part of the subclavian artery? So some of you are saying C, some of you are saying D, some of you are saying A. Okay, so very good. Okay, so guys, the branches of the subclavian artery, they can be remembered with the mnemonic vitamin C and D, right? So VIT are the branches from the first part. VIT are the branches from the first part of the subclavian artery, okay, where V stands for vertebral artery, I for internal memory artery, and T stands for thyrocervical trunk. Okay, so can anyone tell me what are the branches which are going to come from the thyrocervical trunk? What are the branches which are going to come from the thyrocervical trunk? Anyone? थायरोसर्वाइकल ट्रंक में से क्या क्या ब्रांचेस आएंगी थायरोसर्वाइकल ट्रंक से? Thyro means thyroid. Okay, so one branch will be your inferior thyroid artery. ठीक है, inferior thyroid artery. Okay, then the cervical branches will include that. Very good one. You have your suprascapular artery, and you have your transverse cervical artery. बहुत ही अच्छे. ठीक है, अब सी से बताइए. ओके, द ब्रांचेस विच आर गोइंग टू कम फ्रॉम दी, what is C? What does C stand for? C stand for costocervical trunk, costocervical trunk, okay. And costo means your ribs, okay. What is the branch that is going to come from the costocervical trunk, that is going to supply your intercostal space, which is going to supply the first two intercostal spaces. The branch from the costocervical trunk that is going to supply the first two intercostal spaces. First two intercostal spaces branch from the costocervical trunk that is going to supply the first two intercostal spaces, guys. Now I'm going to mix this upper limb with the thorax as well, okay. The branch from the costocervical trunk. I am waiting for someone to answer this question, guys. I am waiting for someone to answer this question. Very simple question, okay. Branch from the costocervical trunk that is going to supply the first two, very good Sharvari Patel, first two posterior, okay. We have the superior intercostal artery and your deep cervical artery, deep cervical artery. So just remember the superior intercostal artery is going to give rise to the first two posterior intercostal arteries, and the rest of the posterior intercostal arteries, they are going to arise as direct branches from the descending thoracic aorta, descending thoracic aorta. And guys, D stands for dorsal scapular artery, dorsal scapular artery. ठीक है. So guys, here tell me also, okay. So an important question again that can be asked in your NEET PG exam, NEET PG 2022 exam. Important question, okay. So which muscle divides the subclavian artery into three parts? Which muscle divides the subclavian artery into three parts? Which muscle is going to divide the subclavian artery into three parts? Anyone? Which muscle is going to? No, it is not pectoralis minor. Pectoralis minor. This is a wrong question, okay. That is why, guys, we have to answer all the simple questions rightly, and that is how we are going to do well. Very good, Hemal Bithani. So it is your anterior scalenus anterior muscle. Scalenus anterior muscle is going to divide the subclavian artery into three parts, okay. So guys, which muscle is going to divide the axillary artery into three parts? Which muscle is going to divide the axillary artery into three parts? Anyone? Which muscle is going to divide the axillary artery into three parts? Anyone, guys? Yes, the video. Very good, very good. It is pectoralis minor. Pectoralis minor. It is going to divide the axillary artery into three parts. Then, guys, talking about one more important artery. That is your maxillary artery. It is again divided into three parts by which muscle? So here I am going to tell you the muscle. It is lateral pterygoid muscle. Okay, it is going to divide the axillary artery. It is going to divide the maxillary artery into three parts. A 19-year-old athlete presented with pain, okay, numbness and fatigue of the right arm. Angiography revealed decreased blood through the blood vessels anastomosing near the surgical neck of the humerus. Okay, the thrombus is likely to be present in. Very good, very good, very good. Okay. So guys, okay, so we have been told to us in the question that there is decreased blood vessel. Okay, there is decreased blood through the vessels which are anastomosing around the neck of the humerus, which are anastomosing around the neck of the humerus. So vessels which are anastomosing around the neck of the humerus, these include your circumflex humeral vessels. These include your circumflex humeral vessels. ठीक है. So circumflex humeral vessels are going to anastomose around the neck of the humerus. So very good, Sharvari Patil. Okay. So branches from the first part. Okay, the branches from the first part of the axillary artery includes your superior thoracic artery. Superior thoracic artery. Branches from the second part. These include your thoracoacromial artery, thoracoacromial artery, and your lateral thoracic artery. ठीक है. And third part की arteries, that is your anterior and the posterior circumflex humeral vessels. These are going to wind around the neck of the humerus. These are going to wind around the neck of the humerus. And one more important branch is your subscapular artery. Subscapular artery. ठीक है. सो एक और इंटरेस्टिंग क्वेश्चन, इंटरऑशियस रेकरेंट आर्टरी. इंटरऑशियस रेकरेंट आर्टरी किसकी ब्रांच होती है? इंटरऑशियस रेकरेंट आर्टरी इज अ ब्रांच ऑफ, इंटरऑशियस रेकरेंट आर्टरी इज अ ब्रांच ऑफ anyone. Interosseous recurrent artery is a branch of anterior interosseous artery, posterior interosseous artery, common interosseous artery, radial artery. Someone is saying radial artery, someone is saying posterior interosseous artery. Dilip Moria is saying common interosseous artery. So guys, interosseous recurrent artery, it is a branch from the very good Mukul Bhuria, Sukhbir Singh, Hemal. It is not radial artery, it is posterior interosseous artery. So just remember, posterior interosseous artery is a branch from the common interosseous artery. So now another question that can be asked, common interosseous artery is a branch of, common interosseous artery is a branch of, common interosseous artery is a branch of what? Common interosseous artery is a branch of what? Come on guys, come on. Very good Sukhbir, amazing answer. Common interosseous artery, it is a branch of the ulnar artery. Okay, so following radical mastectomy, patient is unable to extend, adduct and internally rotate the arm. Extend, adduct and internally rotate the arm. Which of the following muscles is damaged? Following radical mastectomy, in a case of CA breast, okay, patient is unable to extend, adduct and internally rotate the arm. ठीक है. So which of the following muscles is damaged? Okay, so which muscle is responsible? Okay, that is inserted onto the floor of the bicipital groove. The muscle which is inserted onto the floor of the bicipital groove. Okay, no, it is not deltoid. Okay, deltoid will only cause abduction of the arm. Okay, deltoid will cause abduction of the arm. So this is a wrong answer. Teres minor will not cause internal rotation. It is responsible for external rotation of the arm. It is responsible for external rotation of the arm. Okay, and pectoralis major. Okay, pectoralis major is responsible for the flexion of the arm. Flexion of the arm. ठीक है. So guys, it is your latissimus dorsi. It is your latissimus dorsi. Okay, which is going to be injured. That is supplied by the thoraco dorsal nerve. That is supplied by the thoraco dorsal nerve. Okay, right, right. ठीक है. So guys, let us discuss few more spotters. Okay, few more spotters. Okay, which is the muscle, which is the muscle which is being shown here, which is the muscle which is being shown here, which is the muscle. Okay, fast, we have to reply fast. Which is the muscle which is shown here? They can give you a cadaveric image which is inserted into the lateral lip of the bicipital groove. Very good. It is your pectoralis major muscle. It is responsible for flexion of the arm, medial rotation of the arm. Okay, floor of the bicipital groove, we have your latissimus dorsi muscle, and medial lip of bicipital groove, which is the muscle which is inserted onto the medial lip of the bicipital groove. Muscle inserted onto the medial lip of the bicipital groove. Anyone? Muscle inserted onto the medial lip of the bicipital groove. Come on guys, muscle inserted onto the medial lip of the bicipital groove. Anyone? Which is the muscle which is inserted onto the medial lip of the bicipital groove? Right? Anyone? बहुत ही अच्छे. It is teres major. Okay, so here tell me what is the nerve supply? What is the nerve supply of the teres major? Nerve supply of the teres major muscle is. Nerve supply of the teres major muscle is. Nerve supply क्या है teres major muscle की? So nerve supply is very good lower subscapular nerve, right? Lower subscapular nerve. Okay, so which are the muscles which are going to attach onto the lesser tubercle? Okay, it is your muscles which are going to attach onto the lesser tubercle. Very good. It is your subscapularis muscle, which is going to be responsible for the medial rotation of the arm, and it is supplied by both upper and lower subscapular nerve. Muscles attaching onto the greater tubercle. These include your supraspinatus, infraspinatus, and teres minor muscle. So guys, supraspinatus and infraspinatus muscle, these are supplied by suprascapular nerve. Okay, so you have to tell me teres minor muscle. Okay, teres minor muscle is supplied by which nerve? Teres minor muscle is supplied by which nerve? Teres minor muscle is supplied by which nerve? Anyone, guys? Very good. Teres minor muscle is supplied by your axillary nerve, right? Axillary nerve is going to supply your teres minor muscle. We have already discussed deltoid muscle. Deltoid muscle is supplied by axillary nerve. ठीक है? It will be responsible for the abduction of the arm. Serratus anterior muscle is also known as Serratus anterior muscle is also known as serratus anterior muscle is also known as it is supplied by the long thoracic nerve. Long thoracic nerve is a branch from the roots of the brachial plexus. It is also known as boxer's muscle. Boxer's muscle. Why? Because it is going to result in the protraction of the scapula. Protraction of the scapula. Okay, protraction of the scapula, right? So guys, one very important question: which are the structures, which are the two muscles, which are enclosed by this clavipectoral fascia? Two muscles enclosed by this clavipectoral fascia. Two muscles enclosed by the clavipectoral fascia. Okay, and what are the structures? What are the structures which are pierced by this clavipectoral fascia? Okay, structures, no, it is not minor and major, it is minor, pectoralis minor, and your subclavius muscle, Okay, these are the two muscles, the structure which are going to be pierced by this clavipectoral fascia. These include your cephalic vein, okay, lateral pectoral nerve, okay, then you have your thoracoacromial artery, and you have lymph nodes, okay. So these are the structures, okay, which are going to be pierced by this axillary artery we have discussed, brachial plexus we have discussed, right? Biceps muscle, okay, biceps muscle, it is supplied by the musculocutaneous nerve, okay. Biceps muscle, it is supplied by the musculocutaneous nerve, okay. And the two heads, what is the origin of this biceps? One, the short head arises from the coracoid process. And the long head arises from the supraglenoid tubercle, right? So guys, can anyone tell me what is the investigation? What is the investigation that is being shown to you in this image? What is the investigation that is being shown to you in this image? What is the investigation that is being shown to you in this image? So this is the CT angiography image of the upper limb, okay. And in this image you can see two vessels, okay. In this image you can see two vessels, A and B, okay. In angiography image, what you are going to see, you will see that the vessels, they will appear bright, right? The vessels, they will appear bright, okay. So guys, can you help me label the two vessels that are being shown in this CT angiography image? Okay, two vessels A and B which are being shown in this angiography image. So this is the CT angiography of the upper limb, the two vessels. This is a radioanatomy correlation question that can be asked. They can ask you what is the investigation that is being shown to you, okay. Which two vessels are being labeled here? You can only see one bone, it means that it is humerus, okay. So the two vessels, very good Hemant, amazing answer. The two vessels that are being shown here, these are your brachial artery and your profunda brachii artery, okay, profunda brachii artery, okay. So guys, last में I would like to discuss your I would like to discuss the Cutaneous nerve supply of the hand. Cutaneous nerve supply of the hand. A very important topic. Very important topic. So guys, if we have a look at the palmar aspect, okay. So let me just bring a new page for you. Bring a new page for you. So this is the palmar aspect that I'm going to draw, and this is the dorsal aspect. Dorsal aspect. Okay. So guys, if this is your palmar aspect, this is your palmar aspect. Okay. So guys, tell me. Okay. Lateral 3.5 part. Lateral 3.5 part. Lateral. Lateral 3.5 part of the palmar aspect is supplied by cutaneous nerve supply. We are discussing the cutaneous nerve supply of the hand. Cutaneous nerve supply of the hand. So tell me, lateral 1.5 part of the hand. Lateral 1.5 part of the hand is supplied by which nerve? Lateral 1.5 aspect of the lateral, no, palmar aspect, Hemal, palmar aspect, palmar aspect. Lateral 1.5, lateral 1.5, it is supplied by the median nerve. Lateral 1.5 aspect is supplied by the median nerve, and the medial 1.5, medial 1.5 aspect of the arm, okay, of the hand, it is supplied by the ulnar nerve. Ulnar nerve. ठीक है. Now guys, let us discuss the dorsal aspect. Dorsal aspect of the arm. Dorsal aspect of the hand. Dorsal aspect of the hand. Right? If this is your hand, so guys, tell me, medial 2.5 aspect. Medial 2.5 aspect is supplied by medial 2.5 aspect on the medial 2.5 dorsal aspect of the hand is supplied by medial 2.5 dorsal aspect of the hand is supplied by. Very good, very good. It is supplied by the ulnar nerve, and lateral 2.5 aspect, lateral 2.5 aspect, lateral 2.5 aspect is supplied by the radial nerve, radial nerve, right? Radial nerve, right? So guys, before I end this session, okay. So let me just. So guys, we have this Unacademy Lite also available for NEET PG. So few important things that you can use Unacademy Lite. Okay, we have this various batch that is coming up for the UPSC CMS revision. Okay, we have this FMG high yield revision batch. Okay, that has just started. You can join this batch. Right? Then guys, we have this NEET PG practice league. Okay, we have your we are launching also a question bank UPSC CMS course, right? So you can utilize these courses, right? NEET PG subscription, you can go for the iconic subscription as well, in which you are going to get the prep ladder also, and you are going to get the Unacademy Plus subscription as well, right? So you can use the code HimanshuMMC to enroll for these courses. And guys, I hope you enjoyed this quick revision session on the upper limb anatomy. Before your NEET PG exam, I'm going to bring one session for head and neck anatomy as well, and one session for thorax and the GI session, right? So thank you guys. I hope this was useful. So till then guys, bye bye, take care, keep working hard.